My name is Nadiya Dragan. I'm a breastfeeding counselor in Lebanon and a mom of 3 children. During the presentation today, we're gonna see the key messages, the highlights of what is known about breastfeeding during coronavirus. Why it's important to keep the mom and baby together if mom is suspected or already confirmed to have COVID-19, how mom should breastfeed, which precautions are recommended, what to do if mom is very unwell and unable to breastfeed directly, and what if the mom is so ill that she's not able even to express milk, what to do about that. And as a breastfeeding counselor, I also added a few more topics to this discussion today, such as how stress affects breastfeeding, medications and breastfeeding, and how to increase milk supply, because I know that this may be of great interest to many of us. So we are many people today. Probably most of us are parents. Some of us may be activists, students, healthcare providers. I thank you for your trust and being here today. And I believe that all of us today are united in this session with the desire to learn how to protect our children better. And breastfeeding can do this for us. And during this presentation, I will explain how breastfeeding is a huge measure to protect our children. Let me start by saying that breastfeeding saves lives. Imagine, on the UNICEF page, you can read that 800,000 lives of children can be saved every year, of children under 5 years, if moms exclusively breastfed till 6 months. 800,000 lives of children. That's because breastfeeding drastically reduces deaths of children due to acute respiratory diseases and diarrhea. When babies are born, they have immature immune system, and they need good 5 years to develop that immune system for them. During this critical, vulnerable time, breastfeeding gives huge help to children, to protect them from infections, and also to help their own immunity to mature and develop faster. UNICEF is also stating that exclusively breastfed babies are 14 times likely more to survive than formula-fed babies. Do you imagine that? 14 times more likely to survive. And these statements, they're based on studies. The evidence is available. We just need to look it up, go to reliable sources, and it's all there. Breastfeeding saves lives. And how this happens is that breast milk is packed with specific immunity components. There are many different types, and they do different functions in the child's body. Some of them are training the immune system of the baby to work better. Some of them are protecting the intestinal lining. Some of them are guarding off bad bacteria in the body of the child. Some of them are fighting for the child so that the baby can fight off the viruses, bacteria, fungi. The components that are fighting for the baby are usually known as antibodies. These are immunoglobulins, and there are 5 types of immunoglobulins, and all of them are present in breast milk. It is estimated that 1 teaspoon of breast milk has more than 3 million germ-killing cells. Isn't this fascinating? 1 teaspoon. So if mom can give a tiny bit of her milk, 1 teaspoon a day, she is doing a huge help to support and protect her baby. And of course, breast milk is dose related, which means the more you give, the more effects you can expect. And all these immunity components are completely absent in formula. There are none in formula. And this is one of the reasons why formula-fed babies who are fed artificial powder milk, they are at such high risk for infections and even death under 5 years. And we need to be aware of that as well, because we don't often hear such things. I'm myself a breastfeeding mom of 3 children. And I can tell you, it's really interesting to observe the kids who are exclusively breastfed. Exclusive breastfeeding means that children do not receive anything other than breast milk in the early 6 months of their life. So no formula, no water, no Yansun, no herbal drinks, no foods, exclusive breastfeeding, and this is what's recommended by the health organizations around the world, including Ministry of Public Health in Lebanon. So when babies are exclusively breastfed, does it mean that they never get sick? No, they do. As a mother of 3 children, I can tell you they do. But it's extremely unlikely for babies to get sick under 6 months when they're exclusively breastfed. And even if they do, they usually recover much faster than children who are not breastfed. And they need very little medical interventions. And they feel much better. The course of the sickness is not that severe. And when I have a second and third child, I know that the exposure to the new baby, it becomes higher because the older kids bring home viruses and bacteria from playgrounds and school. And even in that situation, even when my older kids will be sick, my young one will be very unlikely to experience a sickness. And breastfeeding mothers with whom I'm in contact, they confirm the same, that even when family members are sick, including the mom herself, the breastfeeding and exclusively breastfeeding baby usually will not have any symptoms of infection. It's amazing. And one explanation to that could be because breast milk, not only it's packed with immunity components, but these components are constantly changing. Breast milk composition is changing according to the needs of the child, according to the age of the child, according to the environment exposure. What that means is that if someone came in sick to the environment where the baby is, let's say an older brother, sister, family members, as soon as the mom is exposed to that, she changes the programming in her milk, and her milk composition changes so that mom can provide antibodies to be passed to the baby and as a preventive measure, protect the child from getting sick from that virus or bacteria or fungus. If the baby gets sick, already exposed to something, as we know, we get sick before we have the symptoms. So as soon as the child gets exposed to something and comes in contact with, before we know, through saliva, the baby is going to communicate to the receptors around the nipple of the mother's breast what immunity the baby needs for that virus and bacteria and fungus, so that at the next feeding already, mother's milk can provide the necessary antibodies and cure the child before there were even symptoms. And this is how very often kids will be exposed. They will cope with it, they fight it off, and we never knew that the child was sick at that time. One thing that we may notice at this period often is that the baby will want to nurse more frequently. So we see the baby wants to nurse and nurse and nurse. There is no coughing, no sneezing, no temperature, but suddenly baby wants to nurse more frequently. That could be one of those situations where the child knows he needs now more immunity, and that's why he keeps on asking mom to breastfeed more frequently, and mom will do the job beautifully at protecting the child and curing the child from the illness. And a beautiful thing happens when mom herself gets sick. I know it's not a beautiful thing to get sick, but when mom gets sick, when her body starts fighting the infection, millions of antibodies are passed through the milk to her baby to keep her child protected from what she is having. Dr. Jack Newman, a famous IBCLC and pediatrician in Canada, says that breast milk is a fascinating fluid. It is. It's miraculous what our breast milk can do for our children, and we're still learning new things about this. So now in the time of coronavirus, when we are hearing the news, it is very stressful. We're all worried, especially when we have young children. And, you know, at first we were told that coronavirus is not as much of concern for young population, for healthy, strong people. It does not affect seriously children under 2. Children are not at risk for dying from coronavirus, right? So that was reassuring somehow, although still very disturbing to see the news around the world. But now the situation has been changing. And we now have reports from around the world that children do get sick. Healthy young people with no underlying condition do get sick, and they may reach critical conditions, including children under 2. And very sadly, we have been hearing of cases of infants dying from coronavirus under the age of 1 year. And in the developed countries, in the United States, over the past few weeks, several infants died under 1 year. This is heartbreaking, it's devastating, and of course, it's very stressful. And when a breastfeeding mom gets stressed, Many people will start telling her, you should not breastfeed if you're getting stressed. Stress makes your milk bad. Stress makes your milk poison. Your milk will go away, right? We hear such things all the time, and we may be wondering, is that true? Is it bad if I get stressed? Would I lose my milk? So please allow me to explain to you how lactation works. So you can decide for yourself whether you should be that much worried about stress in terms of breastfeeding. In the beginning, when mom gives birth, she's gonna have the early milk called colostrum. I think in Arabic it's called simah. It's that very thick substance, a golden color, brown color, transparent. It's very difficult to see, to express it from the breast. But this is the early milk, and it's exactly what the baby needs right after birth. It is packed with immunity, with the immunoglobulins, with the enzymes to set up digestive flora. It's like giving the baby all the immunity the mom has to protect the child and help the baby survive in the world outside the womb. When the baby is born and this early milk is being given at the first couple of days, this is the only thing that the child needs. And the baby is not ready for white milk, so it does not help to give additional milk to the child, white milk of another donor mom or from formula. It is not helpful. Baby needs several days to be just on these drops of colostrum. And people may think, but colostrum comes in drops, baby will be hungry, it's starvation. No, because we know that the stomach of the child is very small, it's not fully open right after birth. On day one, it's the size of a small pearl, so it can only fit up to a teaspoon maximum. And mom on average produces 1.5 to 2 teaspoons per feeding when she gives birth. So we produce more than the stomach needs. And then slowly the stomach will be opening till eventually by 1-2 weeks, the stomach will open and it could take 30-60 milliliters of milk. So the nature didn't make any mistake by giving us drops of colostrum. It gave exactly what babies need. And colostrum is produced as a response of pregnancy. If mom went in pregnancy beyond 16-20 weeks, she's gonna start producing colostrum even if she never sees it. So it's a given fact for every mom. It's done by nature as an effect of pregnancy. So every mom's gonna have that milk. And then the white milk will be driven mostly by the rule of demand and supply. You see, as soon as baby is born, when the placenta comes out of mother's body, the brain starts releasing a hormone, prolactin. This is a hormone responsible for the white milk production. And about 3-5 days after birth, white milk will start coming in. So colostrum will be changing. The volume of milk will be more, it will be more liquid, more white color, although it still will be golden for a while, because first white milk is mixed with colostrum to protect the baby more with the immunity and necessary things that come in colostrum. And then the milk is driven by demand and supply. What it means? It's a natural rule. The more you demand from the breast, the more you empty from the breast, the more supply you're going to have in return. So the more milk will be coming in the coming days and weeks. Kelly Banyata, a famous United States lactation consultant, calls this use it or lose it process. If you use it, more milk will come in. If you did not use it and you stayed hours without emptying the breast, then you lose it. The milk returns back to blood and the brain takes a notice that this milk was not needed, reduce lactation. So our milk production is driven by demand and supply, how often and how well we are emptying the breast, starting immediately after birth and then continuing in the weeks and months. It is not affected by how much food we are eating, how much water we are drinking, what we are eating and what we are drinking. Please know this, ladies. This is such a common misconception. Mothers keep on stuffing themselves with the food and plates and soups, and they keep on drinking buckets of water. This has no effect on the milk production. The volume of our milk production depends on how well and how frequently we empty our breasts. Okay, the quality of milk is always excellent for every mom, for every baby. There is no chance that some mom will have fat-free milk or skimmed milk or milk that's not good enough. There is no such thing. And it does not depend on how well mom is nurtured. Of course, we want mom to eat healthy, varied diet for her to be strong and healthy. But please know that mother's milk is produced from blood, from her blood, from her stores in the body. So even if mom is starving, even if mom is not eating well-nourished diet, as it may be happening for many of us being on a lockdown during coronavirus, your milk is perfect and has all the necessary vitamins and minerals that the child needs. And these vitamins and minerals change as the baby grows according to what the baby needs at every day. It's amazing how it all works out. So stress does not affect prolactin. Prolactin is the hormone that makes white milk. What stress may affect is oxytocin hormone. Oxytocin hormone is a hormone of love, and we need it during breastfeeding for the flow of milk. This is a hormone responsible for a letdown, a wave of milk that baby will get after stimulating the breast for a short period. And we will hear the baby starting to swallow sometimes and going, so this is a letdown. Sometimes mothers may feel pins and needles when the letdown starts. Sometimes mom will see another breast releasing a bit of milk while baby is on one side. Sometimes we don't feel anything about this letdown, nothing in particular, no leaking, no pins and needles, nothing at all. But the baby will be getting milk. It always happens. The baby stimulates the letdown, and we need oxytocin hormone for it, hormone of love. We feel that hormone automatically when we touch and hold the baby, when we feel the sensation of the baby's lips on the breast, we respond to it, and with oxytocin, the milk flows. This is where stress may affect our situation, because stress inhibits oxytocin hormone. During stress, when we have adrenaline running, the milk flow may be affected and may go slower than usual. So when mom puts a baby on the breast under severe stress, she may feel that baby is not drinking. The baby may be fussy and frustrated on the breast. If mom is experienced with pumping and she tries to pump, the milk may not flow at all or may flow a little bit, and mom may assume that stress made her lose her milk. This is not correct. And by the way, pumping is a no measurement of how much milk we have and if we have milk at all. We may attach the pump to the breast, not a drop comes out, but we put the baby on the breast and baby goes and gets satisfied. So please be aware of this big trap that many of us are falling into. We should never try to measure how much milk we have with the pump. Pump can never get as much as a strong, healthy, breastfed baby. So if mom is under stress and she feels like, oh, I used to get milk, now I'm not getting milk when I'm pumping, or my baby is getting frustrated, did I lose it? You didn't lose it. The milk is still there. It's there and waiting and ready for the child, but the flow of milk is affected by the stress. And all we need to do is breastfeed more frequently. We need to try to relax ourselves a bit, because this process happens because if mom feels unsafe, it means that she should not be in that situation and feeding. She should take her baby and go to a safe environment and then feed her child. This is how biologically this is all can be explained. So if you feel you are stressed and baby is not drinking well, what may help is go to another room, turn on some music, do some visualization, breathe, relax, look at your baby and hold your child and keep on trying the baby on the breast, left side, right side, left side, right side. You can do massage of the breast. You can help by swallowing some liquid at the time while you're trying to breastfeed, because if you do it while emptying the breast, oxytocin hormone is released, and this is the hormone that we need to help with the flow of milk. But please remember that in general, drinking in between feedings does not help you increase milk supply. The effect is just from drinking while breastfeeding or pumping. So if you feel let down and slow, you can help yourself and swallow some liquid, and then this may help with the flow of milk. If your child is frustrated on the breast and he's getting angry why the milk is not flowing as easily as usual, what you can do is do breast compressions, a wonderful technique well explained by Dr. Jack Newman, where you would put your hands over the breast, and while baby is on the breast, you squeeze the breast towards the child. You start from up and under your arm and under your neck, because we have milk making tissue everywhere, and you squeeze forward, pressing firmly, and you keep holding so baby can catch all that milk, and you'll hear the baby swallow, swallow, swallow. When baby stops, you can open and do another deep compression. You compress gently but firmly, lifting your lower fingers up and the thumb down, forward to the child. You can do the same if you're pumping and you need to get more milk out. And this is called hands-on pumping technique. Nancy Mohrbacher wrote excellent articles about it, how it can help us even double the amount of milk we're getting, just using our hands during pumping. Massaging before, compressing during, and finishing with some drops of hand expression in addition to pumping. So also what you can do if your baby is frustrated with a slower flow of milk during stress is lean forward. When we lean forward, the gravity helps our milk come out faster. We can also hold the baby in our arms at the breast. And when we see babies getting tense, we can do this rocking left and right, because rocking reminds the baby of how safe and comfortable the baby was inside of our body during pregnancy, when baby was swinging in amniotic fluids when we were walking. So if baby is getting frustrated on the breast, we can do a bit of rocking, and the child will be more likely to stay patient and keep on nursing. And please be sure that even if baby is not having an abundant flow due to your extreme stress at that moment, you can compensate for it by breastfeeding more frequently. The more frequently you breastfeed, the more milk the baby will receive, the faster all the milk will be released, and oxytocin hormone will go up, and you'll be able to nourish your child. So you don't need to worry about it. And of course, stress does not make your milk bad. This is complete misconception. Our milk does not make our milk bad quality or bad taste. It doesn't make our babies stressed out if we were stressed out. Our milk does not become sad if mom became sad. Please don't let anyone tell you these things, and remind them that no one is testing cows how happy they are when they're being milked. And yet everyone is using formula and no one's wondering about that. So why are they putting pressure on breastfeeding moms to be always happy while breastfeeding? No one is always happy. We all go through difficult times. We all get stressed. We sometimes cry. We get worried, and our milk quality is always perfect. Okay, so let's talk now about coronavirus. This is the main subject why we gathered here today. The first question that comes to the mind of many people when we think about breastfeeding during coronavirus is, can mom transmit virus through her milk to the baby if she is sick with coronavirus? So until now, there is no evidence of transmission or presence of virus in mother's milk. All right, and recent study, Lancet study, confirms that. Okay. Second question that we may have in our mind is, should we separate mom and baby if mom is sick with coronavirus? Would this help? Should she pump her milk and be away from her child? And this is where we turn to the World Health authorities and leading breastfeeding organizations for the recommendations. And what we see is that they have a beautiful message that is the same across all the organizations. And they are saying breastfeeding mom and child should not be separated. They should stay together, continue breastfeeding as much as possible if mom is suspected or already confirmed with COVID-19. Who says that? WHO, World Health Organization, UNICEF, United Nations Fund for People Activities, World Alliance for Breastfeeding Action, Leche League International, and at the local, national level here in Lebanon, we also have Ministry of Public Health and Lactica, local NGO, driven by parents to protect, support, and raise awareness about breastfeeding. So all of these organizations are stating breastfeeding should be continued if mom is sick, because when mom gets sick, she's gonna pass specific secretory immunoglobulins, the specific antibodies against coronavirus, to protect her child and support immune functions in the baby for fighting if baby already got sick. As soon as the child gets exposed to coronavirus, baby needs protection, and mother's milk will help with that, and direct breastfeeding. So separation, would it help? No, it wouldn't. Baby was already exposed before mom knew about it. But if we separate the mom, direct breastfeeding will be disrupted. And La Leche League, in the media release on nursing your baby during coronavirus, is stating that disruption of breastfeeding may lead to serious negative effects, such as emotional trauma to the infant and child, drop of milk supply, because it's very difficult to maintain breast milk supply while pumping. Breast refusal later on if baby was receiving pumped milk by bottles, and less immunity protection because baby is not in direct contact with the mom, so baby is not communicating to the breast what components are necessary. So all of these factors, they increase the risks of infection for the child, and they increase the risk that baby may get severely ill with COVID-19. Okay. So what all these organizations are telling us while continuing to breastfeed our children directly at all times, as much as possible, even if mom needs to go to the hospital, is do precautions. General personal hygiene precautions. Wash your hands before and after feeding. Wash your hands before touching the child. Wear the respiratory protective mask at all times when you're near the child, and sanitize and disinfect all the surfaces routinely that you touch. All right. And here you may be wondering, but if mom is sick, she may need to take medications. What to do about breastfeeding? It is known that certain components may pass through the milk. So people logically assume that if mom is breastfeeding and some medications go through the milk, then it's not safe for her to continue breastfeeding. So we hear people telling mothers, you have to stop breastfeeding if you need to take antibiotics or painkillers or anti-inflammatories. Or some people say you need to pump and dump your milk. You need to pump and throw it away at the time of taking the medication. And both of these advices are, most of the time, 99% of all the cases are incorrect. Because Dr. Thomas Hale, a very famous author and doctor who issues references on compatibility of breastfeeding and medications, and this is 18th edition, 2019 year. Look how huge it is. It is covering thousands of medications and active ingredients and medications. And after all this research and publishing year after year, he is stating that most medications do not enter milk in levels dangerous for the baby. Most medications are not of concern. But when we look at the leaflet inside the medication box, usually we will see statements like not to be taken during lactation, caution needed if you're lactating, consult your doctor. These statements are not based on research. These are statements pharmaceutical companies are writing to protect themselves from legal issues. If we want to know if this medication is safe for breastfeeding, we want to turn to reliable sources of information that give us research as for safety and compatibility of a medication with breastfeeding. And we have a variety of options where we can turn to across the world. La Leche League International, on the official site, if you go to breastfeeding information resources A to Z and you choose medications and breastfeeding, you'll see a great list of different websites and resources online that everyone can access, where they can test for how safe medication is. Usually it will be a summary of research for each medication and levels of safety. So you can see how that medication is passing, what may be concerned for a premature tiny baby might not be concerned for a child who is older and bigger. We have to take all these factors into consideration when we're making decisions, and most of the time mom can take medications necessary. So if I had to name just a few resources for you to consider, so a great resource is Thomas Hale's website and the book. If you don't have the chance to get the book, you can contact breastfeeding professionals and they will check for you. There is eLactancia. This is a Spanish medical database. You write E hyphen in the center, lactancia with a C inside. .org, and there you will see the references and information to more than 25,000 different medications and active ingredients. And it's written in a very simple manner, giving you levels of risk from green to red, giving you alternatives of medications in the same group if what you were checking for is not the safest option. And on the bottom, it gives you all the references to research, medical information, the Tmax, the half-life of medication. So if you're a medical professional, you have everything information at your fingertips there that you can review. Okay, and there is also LactMed. This is a database founded in the United States, that many medical professionals also refer to. Then what is also very important for us to know, that WHO is mentioning that if mom is so unwell that she's not able to directly breastfeed, the very best next option is to express her milk and provide it to her child. This is not a simple matter, but it can be done if absolutely necessary. So what mom will need to do, she will need to express her milk. She can do it by hand expression or by pumping. And as a breastfeeding counselor, I would like to add here that hand expression videos are available online, and you can also reach the breastfeeding professional to help you learn the technique of how to do this, because it's not just squeezing the breast. It doesn't work that way. We'll need to do a special wave-like motion to stimulate the let down and do this rhythmically and for long enough time. And if you are resorting to pumping, you want to have the most effective, the highest quality pump that you can get to. So electric pump will be more effective than manual pump usually. Double pump is more effective than single pump. And it's also faster to use because you can empty 2 breasts at the same time. And if you can get to use a hospital grade pump, this usually is considered the golden standard of pumping, when mom needs to pump to establish supply when she's separated from her child, or to maintain it when she's separated from the child due to illness. So you would need to express your milk by hands or by the pump minimum as often as the baby is nursing when you're together, and not less than 8 to 10 times per 24 hours. And every time at least 15 to 20 minutes. It should be thorough emptying of the breast, and frequently, day and night. And then this milk will need to be carefully collected and sent to the baby as soon as possible, so that it has the biggest amount of immunity components and life components that are still there. And you can transport milk from the hospital to the baby in the cooler bag with ice packs around. The milk is absolutely safe there. And if I may mention a few things on storage, I want to tell you that updated recommendations from Academy of Breastfeeding Medicine, Leche League International, they're stating that breast milk at room temperature is safe up to 8 hours, 4 to 8 hours. 4 hours ideal, up to 8 hours acceptable. In the fridge, 3 to 8 days. 3 days acceptable, up to 3 days ideal to use, up to 8 days acceptable. In the freezer, 6 to 12 months. 6 months ideal, up to 12 months acceptable. So during the illness, when we are worried about the child's immunity protection, it helps to try to give the milk as soon as possible. But at other times, you can keep it to the end of the acceptable times. And even after 1 year in the freezer, your milk will be still having plenty of immunity and components that stayed there and survived. And it will be a million times better than formula that never had those components to begin with. Okay, so going back to mom pumping, maintain or expressing milk by hand expression to maintain her supply when she is separated during to illness, it is very important to know that if we can give the pumped milk by a cup or a spoon, it will be much better than giving it by a bottle. A small cup, a coffee cup, a little cup will do great, and babies even at birth can be cup fed. We just need to know the technique. You can see it online. You can ask breastfeeding professionals to show you how to do it. It will help tremendously with reducing the risk of overeating and wasting mother's milk and the risk of breast refusal and bottle confusion. So many moms are struggling with the bottle preference and breast refusal when they introduce bottles at an early age, because no one told them that this is a concern. People told them, just give it, baby will sleep better, pump your milk, test your milk, go out. Mothers start bottles, and then they realize babies are not happy on the breast anymore, or may completely refuse the breast. We have to be very careful with it, because exclusive pumping is very difficult. It's very difficult to maintain our milk production and continue breastfeeding for a long time if the baby is not taking the breast and we have to rely only on expression. So if among us now are mothers who are exclusively pumping, mothers, thumbs up for you. Keep on going. Do not give up. Nancy's with us. Go, Nancy. This is not an easy job, but it is the most beautiful gift you can do for your child for all life long. Keep on going, girls. And if we are directly breastfeeding and we want to avoid the risk of confusion, remember the cups if you need to give pumped milk. And I want to mention that even if mom is very ill and people tell her it's difficult to continue breastfeeding directly, you need to go to the hospital, we will take care of the baby and you just pump, it's easier. No, it's not. No, it's not. It's much easier to have the child with you at the hospital while you need to take medical care so that you can breastfeed directly. And if this is not possible due to the medical procedures of some sort, then you can ask your family to bring baby to you as many times as needed for feedings. It's much more effective. It's much more efficient. It's much more comforting for the mom and the child, and it will be therapeutic, as well as boosting the immunity of the child, because the highest immunity component of milk comes out when the baby takes the milk directly from the breast without the exposure to the light and temperature changes and storage time. Okay, so whenever possible, priority is keep the baby nursing at the breast of the mom, even if mom is severely ill. And then WHO is also mentioning that if in a rare situation, for some reason, mom was so ill, she couldn't even express her milk and breastfeed directly, then she has several options to consider. Wet nursing. Wet nursing is when you look for a mom, a nursing mom, who can temporarily look for your child and breastfeed the child for you while you're unwell. And the regional office of Eastern Mediterranean, WHO, is mentioning it as the first option, what to do if mom is unable to breastfeed directly, wet nursing. Second option is looking for donor milk. In Lebanon, we don't have, unfortunately, a milk bank, but we have informal milk sharing. And you can go on Facebook, Human Milk for Human Babies Lebanon. So you put abbreviated letters, HM, number 4, H, babies, Human Milk for Human Babies, Lebanon. And you will see the group and page where mothers who have extra milk, they share it, they offer it, and families who need the milk can contact the moms and take that milk. And we have beautiful success stories over the years, how this initiative is helping babies who are unwell, who are sick, when mom is unable to breastfeed for some reason. It's amazing. And I heard that now even several hospitals in Lebanon are starting to accept donor milk for premature babies and babies in critical vulnerable state. And really miraculous things happen when babies who were in such a bad state that chances of survival were very, very low, suddenly they start thriving, gaining weight, recovering. So human milk is incredible, really. When we are looking at the last option mentioned by WHO, relactation, I want to explain that relactation is the process of returning your milk after a complete stop. Many people don't know it's possible. It can be done. And many moms will be able to return their milk to a full milk supply. It requires patience, consistency, work, but it can be done. All we need to do is stimulate the breast again after milk production stop. We can do this by hand expression, by pumping, or if baby is still accepting the breast, by putting the baby on the breast many times a day. What we're trying to achieve is minimum 10 to 12 sessions of breast stimulation, and each session at least 1 to 30 minutes. And of course, if you're using a pump, you want to try to get the highest quality pump to get the most effects in the fastest manner. So electrical double, maybe hospital grade pump, if you can reach it. So we keep on stimulating the breast, and at the same time, we're helping the baby to relearn how to breastfeed. And skin to skin, physical contact, holding the child a lot, offering the baby plenty of opportunities to try to breastfeed, encouraging the child, never forcing the baby. We never force the child to take the breast if baby is crying. But when baby is in a good mood, we keep on offering, and maybe the baby will try to latch on, maybe the baby will do a little effort, and we praise the baby, we smile, we say good job. So we cause this positive reinforcement, so baby will try it again. It needs some time. Baby got confused with a bottle and another way of feeding, but baby can come back to breastfeeding because the instincts of breastfeeding are always there. They're inborn. We just need to come to them. They're never lost forever. Even if baby stopped direct breastfeeding for months, we still have the chance to return the baby to breastfeeding. And with relactation, one beautiful thing that we can do also is feed the baby at the breast using supplementing nursing system. It's a device that can be made at home, or it can be bought from different companies, where you have a container where you put milk, whether it's your pumped milk, if you have some, donor milk, or supplementing milk, formula milk. You put it inside, and then there is a tube that you would attach to the tip of the nipple with a small pharmacy tape. And then you latch on the baby. And as the baby takes the breast, you can lift up the container and push the milk forward, so the baby will start getting the milk at the breast. Imagine. So even before mom returned her milk while she's working on relactation, she can feed the baby at the breast using this device. So she does not need cup feeding or spoon feeding or any other thing. She can feed at the breast. And while baby will be drinking that supplement milk, donor milk or pumped milk or formula at the breast, baby will be also stimulating the breast to produce milk faster. And if you also need to give some additional milk to the child, another device, remember the cup. If we are teaching the baby how to breastfeed again, we want to stop all the competition. And bottle is always competition, no matter what the brand of it. Do not believe the statements, this bottle is just like the breast, it's imitating the breast, it's imitating. No bottle is like the breast. Every bottle has risks. And the bottles that are advertised the most in Lebanon actually are the worst for the safety of breastfeeding, because they have very fast speed of flowing and they compete with the breast. And then babies don't want to work on the breast. So consider switching the baby to cup or spoon feeding if you need to give additional milk, if you cannot give everything at the breast with an SNS system. And also mom can refer to special herbs and medications that can help with the reestablishment of supply or increasing it. But I want to mention that most mothers will increase their milk without the need of these things. And if mom wants to consider using them, she needs to talk to her healthcare provider about them and a breastfeeding professional. So she would make a decision which ones are safe and compatible for her health and what are the right dosages. All right. So from here, I also want to mention the increasing supply, as I promised. Let me start by saying that, please, mothers, before you start working on increasing supply, check, do you really need to do this? Because very often mothers will think that they don't have enough milk when everything is absolutely fine. So they will think that they don't have enough milk if baby is not sleeping enough, or not sleeping through the night, or not staying 3-4 hours between breastfeedings, because people tell her that this is not normal, baby needs to sleep 3-4 hours, and she thinks, oh, my milk is not enough. This is not true. Or maybe the mom is feeling her breast becoming softer and smaller after the early weeks after birth, and she starts thinking she's losing her milk. This is not a sign that we're losing our milk. This is a normal physiological process. All of us will start feeling breast becoming smaller and softer after the early weeks of birth, and that's normal. And it's not a reference of how milk we're making. So please work with the breastfeeding professional first to assess your situation, to see, is there a real need? And then see if there is a need, what was the cause of that problem? Why did the milk supply drop? Because for each situation, we need to address the cause. If we don't address the initial cause, no matter how much we try to increase supply, it will be dropping back again if we didn't improve the situation that was causing the drop supply in the beginning. For example, the drop of supply may have happened if baby was not taking the breast deep into the mouth. Baby was taking just the nipple into the mouth and pulling on it. And when baby is doing that, the milk release is not the same. We don't have a good letdown of milk. The milk doesn't flow well to the child. And when the milk is not emptied well, it's not replenished well for the next feeding. Also, when baby is just taking the nipple, it hurts and mom will have cracked nipples, sore nipples. This shouldn't happen at any point of breastfeeding. For breastfeeding to be comfortable for mom and effective for baby, baby needs to take a big portion of the dark circle around the nipple into the breast. Then the baby will be massaging the breast for the right stimulation and the letdown of milk, drinking much better, and mom will feel comfortable. So we need to address that if this was the cause of the low milk supply. Or maybe mom was timing breastfeeding because she was told in the hospital or by her family members that she should do it, that she'd only breastfeed every 3 hours or only 10 minutes on each breast. This is very likely to cause low milk supply because we need to empty breast usually much more frequently than this, and babies need to spend much more time than this on the breast. Babies need to be left to breastfeed as much as they want on each breast without any time limit, and they should be welcome to the breast as often as they want, because the best way to increase milk supply is to breastfeed more frequently. So when baby would feel baby needs more milk, the baby will ask you to breastfeed more frequently, and this is how the body will adjust the nature thought of everything. Okay, and of course, if you are working on increasing your milk supply, you're working with breastfeeding professional, you start increasing the stimulation of the breast, you're adding breastfeeding sessions, you're emptying the breast better, you are working at it, you can do the breast compressions to empty the breast better, you work on the improving latching, you can also stop all the pacifiers, all the bottles, because they are a negative effect on our milk supply, and it is proven by studies. If you want to comfort the baby, instead of giving a pacifier, give the breast. Let the baby breastfeed for comfort. It's a beautiful way to put the baby to sleep and relax and release the stress and stop the baby from crying. Breast is not only for food. It serves so many functions. It's safety, love, reassurance, relaxation, pain relief. We have components that are natural painkillers. So if you think your baby has gases, I think in Lebanon they say mahas. If you think your baby has gases, just put the baby on the breast. Just let the baby nurse and nurse and nurse, and it will help. If your baby is struggling with reflux, our milk has anti-acid components and natural painkillers and anti-inflammatory components. Let the baby have frequent, short feedings as much as the baby wants, so that the baby feels better at all times. Okay, and when you're increasing supply, yes, it takes time. Yes, it takes effort. Tell all your family members you need their support, not criticism and pressure. And celebrate every drop of milk that you will be getting, because every new drop is a drop of health. And now I'm going to share screen, and I'm going to show you visuals of the key messages from the health organizations around the world about coronavirus and breastfeeding. I know many of us are parents, some of us are medical professionals, and I think all of us will benefit from seeing messages, so we can share them with our friends, with our colleagues. So here you're seeing a poster from WHO, Regional Office for the Eastern Mediterranean, emphasizing that breastfeeding strengthens the immunity support for the baby in the context of COVID-19. So it should be preserved. Okay. Next image is showing you the precaution measures that are recommended for breastfeeding moms who need to continue staying together and breastfeeding their babies. So feel free to take pictures of this as well. This one is by Leche League International, one of the oldest and most reputable breastfeeding support organizations around the world. What I love about it is that it's showing that as you need to take precautions and medical care for yourself, keep breastfeeding. Breastfeed as often as you can, breastfeed as much as you can, because baby who was exposed through mom or through family member needs extra protection, and breastfeeding will do it for the children. This is another visual of Leche League International. I like to bring your attention to the top left corner where it says, keep breastfeeding. If baby is sick, they might want to breastfeed more. Remember that. It's a normal thing to observe. A child who is unwell or who feels mom is unwell will want to breastfeed more frequently. It's not a sign that the milk is not enough and that we need to supplement. It's a natural defense mechanism of the child telling us that baby wants more immunity. Baby wants more contact with mom, wants more breast milk to support the child. Here we see the statement of WHO that if mom is unable to breastfeed directly, then she should express her milk, and she can express it by hand or the pump. This is the slide on what to do if mom is not able to breastfeed or express her milk. Very rare situations. So relactation, wet nursing, donor human milk. A very interesting slide. Please take photos of it, and you can find these visuals on the WHO site for the regional office of the Eastern Mediterranean. You would need to go to the official website.
So we can share them by email later if you want, Nadiya.
Oh, excellent, excellent. So you will go there to programs, nutrition, and you'll see all the social tiles. So as breastfeeding professionals, as healthcare providers, it's excellent resources available. And this is an example of national resource. It was just issued a few days ago, and I feel so happy to be able to share it with you. This document was developed and published by the National Committee in collaboration with Ministry of Public Health in Lebanon for pregnant and lactating women in the context of Corona. And it's mentioning, and it's all in compliance with the statements of WHO. Breastfeeding moms need to continue staying together, breastfeeding their children, even if they go to the hospital, precautions taken, and expressing milk giving by cup or spoon notice if mom needs to be separated from the child and maintain her supply. This is another local initiative, Knowledge to Policy Center by AUB, stating the same things. Here, I'd like to quickly bring your attention for the pregnant mothers It's stating that if mom is pregnant, this is a recommendation for healthcare providers who are helping a mom giving birth with COVID-19. They're saying that her request should be respected. She should have a birth partner with her if she wants, and she can take any position and be active during the birth as well. This is a specific slide saying that mothers who are giving birth with COVID-19 do not have to have cesarean birth. The priorities for the vaginal birth, and WHO on the official page for questions and answers on COVID are stating this as well, that pregnant women giving birth should not be sent for cesarean section. The priority is for natural birth. And here is the actions for health facilities and their staff by WHO, and they're saying that we should never promote breast milk substitutes, feeding bottles, teats, pacifiers, or dummies in any part of our facilities or anyone by the staff to protect breastfeeding. And mother should remain with the baby after birth. She should start breastfeeding as soon as possible. She should be in the same room. She should do kangaroo care. She should breastfeed on demand, receive the support to be protected from the infection while taking the precautions. And we have here an Arabic document. If part of the slide is covered by the faces on Zoom for you guys, you can find this document if you go to K2P, Knowledge to Policy a website and Facebook page, and you can see that they're also stressing in Arabic that COVID positive mothers need to start breastfeeding as soon as possible with their babies in the same room, skin to skin, and they need to have support for establishing of breastfeeding. In Lebanon, we have an amazing law number 47, 2008, that ensures that no promotion, advertisement, or distribution of formula and breast milk substitutes, bottles, and pacifiers should be done in any place of Lebanon. And I thank again Lactica team for sharing with me this document. You see the front page in Arabic and in English. Document is public. Who needs it, please contact me. I also will gladly share with you the whole text so you can be aware of it. And this is a picture emphasizing the main parts of the law, that what it forbids: the formula, bottles, pacifiers, breast milk substitutes, promotion, distribution, free gifts anywhere, anyhow. Okay, and the recommendations around the world is, including Lebanon, and Ministry of Public Health is stating that as well, is that we should start breastfeeding as soon as possible after birth, within 1 hour. We should continue exclusively breastfeeding with no food, no Yansun, no formula for minimum 6 months, and then following developmental signs of readiness, introducing solids and continuing to breastfeed up to 2 years or beyond. And I know some of you may say, but not everyone has milk. So many mothers are not having milk. They need bottles, they need formula, they need pacifiers. And it's good that maybe sometimes they're, receiving gifts and packages. No, it's not good. It's undermining the journey of every mom. And that's why there is a law in effect to protect breastfeeding. And we should tell everyone about it. And if you see violations, if you see someone promoting bottles, pacifiers, formula, or giving free gifts anywhere, you can report it to the Ministry of Public Health. You can report it to the Lactica, the local NGO that's helping us protect and support breastfeeding. And there'll be a report sent so that that institution, that place will be notified that they cannot do such a practice. And physiologically, 97% of women can have all the milk needed, not only for one child exclusive breastfeeding, but for multiples, for twins and triplets. All we need to do is to have access to reliable information, correct information, and the right resources and support. Like if we're talking about multiples, this is an amazing resource, Breastfeeding Multiples, written by Karen Gramada, a whole book on how to manage in all different situations. We have lots of support systems in Lebanon. Leche League International is offering free breastfeeding support meetings to mothers in 3 locations in Lebanon. Now they're temporarily stopped due to the lockdown, but there is a talk about starting online sessions. So stay tuned about that. Lactica is doing B events and doing free breastfeeding awareness sessions for medical professionals and for parents. We have mother support groups on Facebook, on WhatsApp, mothers helping each other. And we have now a whole referral list of breastfeeding professionals who do home visits, hospital consultations, online sessions, phone help. The help is available. Dear ladies, if you're having any challenge with breastfeeding, contact a reliable source of information and you can overcome that problem. You can successfully and exclusively breastfeed and celebrate every drop of your milk. And I'm so happy to tell you that over the past 10 years of being in this field, I'm seeing more and more moms breastfeeding and succeeding with breastfeeding. And when you succeed in breastfeeding, you overcome your early challenges, which is very normal. You are starting to love it so much that the months start passing quickly and mothers find themselves breastfeeding even beyond the 2 years of the recommendation. And it's wonderful. And the longer you can breastfeed, the better. Your milk never stops giving benefits to your children when the child is older. Remember, immunity needs 5 years to be developed. So the longer you can breastfeed in that period, the better it is. Enjoy it. It's a way of mothering. It's a way of communicating. It's a way to transmit our love. With this happy note, I'd like to close my talk presentation and open it for the Q&A.